eyes. All right, now I'm gonna look at your anterior eyeball structures. And so the cornea are clear, no opacities noted, that means there's no cloudiness. The iris, both of the irises are blue in color and they're flat. And the pupils are equal in size and round. So now we are going to do an accommodation test, okay? Now I'm just going to stand right here and you look at a distant object over my shoulder first, and then I want you to look at my finger and follow it into your nose. Perfect. Both eyes converged on my finger and both pupils constricted equally at the same time, so that's a perfect result. And now I'm going to go dim the lights a little bit, okay, for a couple tests. Alright, now I'm going to do a pupillary light reflex test. I'm just going to shine this light in your eye, okay? Alright. Perfect. Alright, both pupils, I noted in both eyes a direct pupillary response, which indicates that the eye that the light was shined into constricted, and in both eyes I noted a consensual light reflex, which indicates that the pupil that did not have the light shined in it also constricted at the same time equally. So now I'm going to look at your optic disc with the ophthalmoscope. So first, I'm going to find the red reflex and follow it. Perfect. I'm going to do the same thing with this eye. Perfect. Okay. The optic disc in both eyes was round, intact, and it was a creamy yellow-orange in color. I apologize. All right. Now I'm going to move on to your ears, okay? Now I'm just going to inspect your ears and look. They appear symmetrical. There's no inflammation, lesions, masses, nodules noted. The angle of attachment is less than 10 degrees for both. That just means that they're not sticking out here like this. And I don't see any foreign objects coming out of the external auditory meatus, and the external auditory meatus appears firm. It's not inflamed. There's no excessive cerumen coming out. I don't see any discharge. And I do want to note that she has 3 piercings on this ear and 3 piercings on the right and 3 piercings on the left ear. And now I'm just going to palpate on your ear a little bit, okay? Let me know if you feel any pain. Any pain with that? All right. Any pain with that? All right, perfect. Now I'm going to look inside your ear with the otoscope, okay? All right. Now I'm just going to pull your pinna up and back, okay? And I was about to ask you if you could do that. All right. The ear canal, the external canal is patent. It has no inflammation or drainage, no excessive cerumen, no lesions noted. Now I see the tympanic membrane. It is translucent, pearly gray in color. It is intact and slightly conical in shape, and the cone of light is at 7 o'clock for the left ear. I'm going to look at your right ear. I'm going to pull your pinna up and back. You don't have any pain with that? Okay. I need to turn it on first. Alright. Right. The external canal is patent,
I don't see any inflammation or redness, no lesions, no drainage or excessive cerumen. The tympanic membrane is intact, pearly gray, translucent in color, and slightly conical. And the cone of light is at 5 o'clock on this here, which is perfect. Now, after this, sorry, my breath. We're gonna do a whisper test. So I'm gonna come back here behind you.
Okay.
And I am going to ask you to push your tragus in to plug your right ear. And then I'm gonna whisper a series of numbers and letters, and I'm gonna need you to repeat those back to me, okay?
Mhm.
All right, here we go.
4, 6, 7.
No. So we're gonna do that one more time, okay? Are you ready?
Yeah. 4C7.
Okay, correct. All right. Now we're gonna do the same thing on the other ear.
587 or 587.
Yes.
Okay.
Yes, correct. 587. So I would note maybe some slight hearing impairment in the left ear, but no, you passed. So that indicates no hearing impairment. So now, normally at this point in the assessment, we would do the nose, mouth, and throat, but I'm not going to be able to do that because of the mask. So normally I would look at your nose, note that it was symmetrical, that the skin around it was consistent with the rest of the skin on the face. There's no inflammation, lesions, no deformity in the nose, no masses. And I would look to note that that there was no like drainage from your nose. And then I would test the patency of each nostril. So first I would ask you to hold one and blow out, and then hold the other and blow out. That would just let me know if there was any obstruction at all there. And then I would look inside your nose with my nasal speculum, and and I would look at the mucosa and note that it was pink and moist. It wasn't overly inflamed or anything like that. That there was no drainage and anything like that, and any foreign objects, lesions inside your nose. Then I would look at your septum and make sure that it wasn't deviated or perforated at all. And then and there was no bleeding. Then I would look at your turbinates and make sure there was no swelling there or polyps. And then I would palpate your sinuses. I think we can do that with your mask on, if that's okay with you. All right. Let me know if you feel any discomfort here. Okay. Any discomfort there? All right, perfect. Any discomfort here? All right, good. All right, and then I would look at your mouth and your throat. And so first I would look at your lips, and I would note that they're symmetrical. They should be pink in color and moist. They shouldn't be cracked or any lesions on them at all. Then I would look inside your mouth at your teeth. I would look at the condition of your teeth and note the cleanliness of them, note any dental caries or anything like that. And I would note that the upper teeth the upper incisors overlap the lower, and that when you bite together, your back teeth come together. And then I would look at the number of teeth, which can vary depending on whether you had your wisdom teeth out or not. And I would look at your gums and make sure that they were not bleeding or inflamed at all. They should be pink and moist in color. And then I would look at your tongue and your mucosa of your mouth and note the color there, make sure there's no lesions or anything there. I might palpate your tongue to make sure there's no masses or nodules in your tongue area. And then I would note the amount of saliva present in your mouth. And then I would look at your hard and soft palates on the roof of your mouth and note the color. The hard palate should be slightly lighter in color than the soft palate. I would note the transverse rugae on top of your mouth and make sure that your hard palate and your soft palate were intact. And then I would look at your uvula and make sure it was midline and symmetrical. I might ask you to say so that I could look and make sure that it goes up when I do that, make sure that it's functioning correctly. Then I would look at your tonsils and I would look for any redness or inflammation there and make sure there's not any pus or anything on them, may indicate infection. And then I would grade them. So it's like a 0 to 4 scale. And they should really be at a 2+ or lower, because when you get up to 3+, they're touching the uvula, and 4+, they're touching each other, and they shouldn't be that big. And then I would look at your pharyngeal wall, just note the color, and I might assess your gag reflex. And before we stop, I did forget one thing on your eye assessment. So if you could, when I was inspecting your external structures, if you could look up for me, and I'm just going to pull your eyelids down here, and note that your sclera are white. I didn't see any redness or yellowing that would indicate jaundice. Your conjunctiva are they're moist and pink, and there was no discharge. And the lacrimal apparatus was clear with no swelling. Okay. All right. Perfect. Do you have any questions for me before we call it?
No.
All right. Are you comfortable sitting up like this?
Yes.
All right, perfect. Here's your call light if you need me.